Today we're going to have Lori Janke. She's co-owner of Once Upon a Child and close mentor Newport News. And she's going to be going over the VOSH plans for COVID-19. She also has 20 years experience as an HR generalist, and she's currently Human Resources Director with US LBM, in addition to owning her own businesses. And she's talked to us many times about human resources, and always good information. So Lori, I'm going to give it to you.
Okay, thank you, Beth. As Beth said, it's my pleasure to be here. I am a co-owner of 2 retail businesses in Newport News. But in my day job, I am an HR director. US LBM is a nationwide distributor of lumber and building materials. We also manufacture things out of wood products for construction. So we have about 9,000 employees. It's a $4 billion business. We're in about 26 states. So I've been dealing with COVID response on a very big scale. In my day job, I am a member of the COVID emergency response team at US LBM, and I'm also managing these requirements for our businesses along with my business partners. So I feel like I've been dealing with COVID everywhere in big, small, and medium-sized businesses. So what I wanted to do today is talk through what is now a permanent standard that is coming out for Virginia, and it is a requirement for all businesses to comply with this standard. So let's start with what is VOSH? VOSH is the Virginia Occupational Safe and Health Compliance Program that is part of the Department of Labor and Industry in Virginia. So if you think of the Occupational Safety and Health Administration, OSHA, at the federal level, VOSH is kind of Virginia's version of that for businesses in Virginia. So as a normal duty, they would be conducting inspections of private and public sector employers to ensure compliance with all laws, standards, and regulations of the Commonwealth. So if you're not familiar with who VOSH is, it probably means you've never had an inspection, but they are the occupational safety and health arm of the Department of Labor and Industry in Virginia. So Virginia did become the first state to issue mandatory COVID-19 workplace safety rules, and they went into effect on January 27th. Now, everything that I'm sharing with you, this information is available in various places on the Department of Labor and Industry website. And one of the links that, or one of the slides that I've included in the presentation gives you links to many of the things that I'm going to reference that are required for compliance. So no matter the size of the business or the level of work or whatever you do, this standard applies to all businesses in Virginia. So this particular standard, as I was starting to say, no matter the size of the business or the level of the exposure risk, the permanent standard imposes several mandatory requirements for all Virginia employers that fall under the jurisdiction of VOSH and the Department of Labor and Industry. So that's essentially all private businesses in Virginia. The only businesses in Virginia that would be exempt from these standards are federal employers. So if you think of the shipyards and the things like that in Hampton Roads, they fall under different standards. But outside of federal employment, this applies to everyone. So why do we have the new standards? It's really simple. It's to prevent the spread of SARS-CoV-2, which is the virus that causes COVID-19. So everything in these standards is about helping businesses prevent and minimize the spread of COVID-19 and puts plans in place to deal with exposures or illness as they're known. So what does this have to do with loss prevention and things that you need to think about with your business? Well, first of all, you want to protect your employees. Prevention and minimization is the best thing we can do as employers to ensure that our employees do not come in contact unnecessarily with people who are sick or suspected of being sick with COVID-19. Complying with these standards is mandatory. And when you don't, what happens? Well, you can get citations, fines, and penalties. There is a big scary number that typically is $13,000 per day when you fail to comply with mandatory standards. Now, that's a big, bad, scary number. People throw it around. Odds are, if an inspector shows up and you're not in compliance, you are not going to get hit with that kind of fine. You're going to get a citation. You're going to be given time to remediate or abate whatever the violation is. And there probably isn't going to be a monetary penalty unless there's a follow-up inspection and you didn't comply. The really big loss, though, other than our team members getting sick and potentially having issues with business continuity is the loss of reputation in the community. And a lot of us have been dealing with this since the beginning of COVID. There were people that were very critical of businesses for being open, and they felt like that we were unduly exposing employees to COVID. But the reality is, if we follow these standards, we can keep our team members safe, we can keep our businesses open, and we can say with confidence to the community that we're doing everything we can do to ensure that our employees are safe. So here's some important high-level information. As I said, the standard applies to all employers within the jurisdiction of VOSH. The standards are based on what is determined to be the exposure risk level or jobs tasks performed in your business. And there's different risk levels. There's very high, high, medium, and low. And we'll talk a little bit more about how those are defined and which types of businesses fall in which risk levels. There are lots of other standards that have come out. So VOSH has said if their standard conflicts with another standard within Virginia, then pick the stricter of the two to comply with. So that's one of the provisions in this standard as well, that if this standard conflicts with another standard in the Commonwealth, you're to comply with the stricter of the two. So here are some important dates. This went into effect on January 27th. Employer compliance is due on March 26th. And there's two main components to our compliance. There's an employee training deadline, and there is a requirement for written response plans. And we'll talk a little bit about both of those in just a moment. So if you look at what's included in the standard, it is lots of different regulations around how we can conduct business in a pandemic. So it's things that you've heard about and you've been living with, and you're probably doing a lot of this already, but it includes social distancing or physical distancing, whatever you call it, self-monitoring of employees for symptoms of COVID. We have some posting requirements for signs. We are supposed to be offering disposable face masks to anyone that doesn't have one. Based on our risk level, we are required to provide PPE. We have cleaning and disinfecting requirements, training requirements, and we are required to prohibit infected workers from coming to work. So those are some of the key provisions of the standards. So let's talk a little bit about these risk levels. So the first thing that I want to make sure everyone is clear on, because it's an important part of the standard, is your risk level is based on jobs in your business. So you could have different job tasks that have different levels of risk. Now, in your business, if you only have one or two types of jobs, chances are that most people will fall within one or two, or they could all be the same. But as you're looking at these standards, what you actually have to do in your business is look at each job family, or job description is the way that I would think about it, and determine which of these risk levels applies. And then that dictates various compliance pieces with the standard. So risk level of low means in your everyday job responsibilities, it does not require you to have contact with people within 6 feet. This would be employees or customers. You have minimal occupational contact with employees or the general public, or you can achieve minimal occupational contact. So I know when the pandemic started, a lot of us started looking at spacing things out, putting up barriers, all of those kinds of things. So it could be that your job normally would have required this, but you've already adapted your operations to build this stuff in. If you can achieve minimal or no occupational contact that requires people to come in within 6 feet, you are classified as a risk level of low. Now, for a lot of us as retailers, this one piece doesn't apply, but if you have employees that can work from home, that's automatically low risk. But for most of us, we don't have that flexibility in retail. For risk level medium, the job requires more than minimal occupational contact within 6 feet. So categories that the state has already identified that would fall in these categories would be waiters, grocery store workers, construction workers, domestic service workers, hairdressers, fitness instructors, people that work in poultry and meat processing facilities, manufacturing workers, and healthcare workers in settings without known or suspected sources of COVID. So if you fall in those categories, the state's already kind of said, this is where we think you fall. For retail, I think it's a little more nuanced, but that is the medium risk. Now, high and very high is probably, you know, unless you have significant space constraints in a retail business, we're probably not going to fall into these. But for risk level high, this is a job or job task that has high potential for employee exposure inside 6 feet. And the groups that the states identified that would fall in this would be hospital workers, first responders, medical transport workers, correctional facilities, mortuary service workers, medical and dental staff, non-medical support staff, long-term care facilities, and home healthcare workers. So they're already by the state kind of designated as high. And then very high is really much more for the medical industry, but this is high potential for employee exposure inside 6 feet. So this would be people performing specific medical procedures like aerosol generating procedures. So think about your respiratory therapist or surgeons, people performing postmortem examinations or laboratory procedures with specimens from individuals. So chances are this one isn't going to apply to any of us here, but that's the very high risk category. So how do you determine your exposure risk level? Well, you start with looking at the tasks that the job does, and you see which one of those levels it falls in. And then you need to look in your work environment. Do you have the ability to distance people 6 feet apart to kind of get you in that low risk, or is the reality that you can't do that? And there are certain parts of jobs that would push you into medium or a higher risk category. You also need to look at presence of the virus. So this is an interesting one. You could be looking at your workforce today and saying, nobody's sick, we've had no positive exposures, we don't have presence of the virus. And then all of a sudden, a couple of your employees decide to get together for, I don't know, a Super Bowl party. And all of a sudden you have an outbreak on your team. So presence of the virus is one that could change a little bit, but you do need to just look at, you know, do you have any sickness today? Because that's part of the equation. You do have to look at the number of your employees and the size of your work areas. So this gets back to, is the social distancing, physical distancing of 6 feet possible? You need to look at working distances for your tasks, and then the duration and frequency of exposure. So it could be that you are able to space people out, except there's one thing where one person, there's no way around it, they have to come within 6 feet of another person. And then you would want to look at how long are they in contact with that person? And then what types of hazards are encountered? So again, in retail, we're not really dealing with a medical type environment where we could have people dealing with the virus as part of their job, but we do have to look at potential hazards that are encountered as well. So it's a combination of all of these things that you will need to apply to your tasks and your work environment to establish your exposure risk level. So if you end up in the very high, or medium category, and again, I think it's unlikely for most retailers that we would end up in very high or high, but it is possible that we would be in lower medium. There are various things that we have to provide based on the risk level. And high level, these are training, PPE, which stands for personal protective equipment. And I'm just going to give one note on that. Masks do not count as personal protective equipment. A lot of people think that they do, but they don't. So in terms of the standard, in terms of CDC and federal standards as well, just be aware that a mask does not count as PPE. We have some anti-discrimination protections that we have to put into place. And then there's a requirement to have infectious disease preparedness and response plans. And there's different requirements on this based on your risk level. So if you are determined to be low risk, and I'll tell you, in our retail businesses, we were able to change our operational practices so that we keep people 6 feet apart at all times. So we were able to put ourselves in the low risk category. You don't have as stringent a requirement for a written infectious disease and preparedness response plan, but we decided just to adopt the one that the state provided as a best practice, and to make sure our associates had all of the available information about what we're doing to manage COVID. So if we jump back up to the top and we talk about training, the requirements for training, again, they get more intense the higher you are in the level. But for those in very high, or medium, you have to meet the requirements of the standards. You've got to train your employees on all of these things: the requirements of the standard, the characteristics and method of spread, the risk factors, the awareness of how the disease is transmitted, and then you've also got to train them on safe and health work practices. So if you fall in those categories, you do have that requirement. And I just noticed my camera's not on, and I'm trying to find my controls. I'm sorry, I didn't realize I never turned on my camera. Hello, everyone. All right, so those are the requirements if you fall in very high, high, or medium. And I know what I'm sharing with you right now is very high level, but as I said, I'm going to provide you with links where you can go get all of the specific information you're going to need to implement this in your business. All right, so what are some of the requirements of the standard? First of all, there is a requirement to provide sick leave, telework, and staggered shifts where they are possible. We have to provide policies to our associates for self-reporting and monitoring, how they are supposed to kind of watch for symptoms and report to us. We are also obligated as employers to report to the Department of Labor and Industry any occurrence of 2 or more positive tests among employees within a 14-day period. And that link is going to be provided at the end of the presentation. So please keep in mind, this is a requirement of the standard for employers. If you have 2 employees that test positive within the same 14-day period, it has to be reported to the Department of Labor and Industry. They will then report to Department of Health and all other required agencies in Virginia. We are also required as employers to notify associates of a positive test if they were deemed to be exposed. So let's talk about this one a little bit, because this gets really tricky from a law perspective. If you have an employee that tests positive, there's contact tracing that you would need to do as an employer with when did their symptoms start, when was the last day that they worked, and then when they were at work, were they within 6 feet of another employee for 15 cumulative minutes in a 24-hour period? If they have been within 6 feet for a cumulative 15 minutes over a 24-hour period, that is considered a positive exposure. And we have to notify those associates of their positive exposure. But keep in mind, there are a lot of laws that protect health information and that protect medical information. So HIPAA is one and the ADA is another. And COVID is protected by both. So what you cannot do as an employer is say, hey, Susie, I'm calling to tell you John has COVID and you worked with him on Tuesday and he says you've been exposed. So you have to make sure as you're communicating with associates that you protect this medical information. So what you would need to do if you have to notify associates of a positive exposure is to say, someone on the team tested positive for COVID and you have been listed as someone that would have had exposure to that person. Their first question is probably going to be, who was it? You cannot answer that question as an employer. Now, if associates find out on their own or the sick person texts everybody and says, oh my God, I have COVID, you can't stop that. But as an employer, please keep in mind that privacy legislation around medical information, protected medical information, applies to these conversations. Now, most of us have very small teams. One of my store has a team of about 9 and the other has a team of about 20. They all know this stuff within minutes. But as an employer, I can't be the one to share that information. So keep in mind, the standard is that you notify an employee who has a confirmed exposure, and then you would need to follow an exposure plan for that person, because typically with a confirmed exposure, they would be required to quarantine for 14 days. And then you need to have an established return to work procedure for someone who has had COVID. And Beth, I cannot remember when we shared this, but I know sometime in the last year, we shared some templates of prevention, minimization, and exposure plans. So if that's something that people want to get, we do have some samples for you. But again, the state of Virginia is providing you with all the information you need to customize this stuff for your business.
Lori?
Yes.
Is this just exposure? It's not a positive test?
So Yeah,
So
if it's a positive,
if they're just exposed to someone, they have
correct.
to do this. They don't have
Yes.
to have a positive test.
Well, their exposure would be an employee who has tested positive. So if an employee calls you and says, I've tested positive for COVID, that's where we have the obligation to do contact tracing to see if anyone at work was exposed.
Okay, thank you.
And the CDC has all the guidance you will need on exposure plans and return to work plans. But some of the key provisions to keep in mind, exposure starts 2 days prior to an associate being symptomatic. So if they call you and say, hey, I got a headache on Monday, I tested positive on Tuesday, when you're contact tracing, you're going to start on Saturday. So 2 days prior to symptoms starting, and then 10 days after is that window. Now, the standard requires that infected associates don't come to work. So we should all have policies in place. This is under that self-monitoring piece where we have communicated to associates and they have acknowledged that they know the symptoms of COVID. If they have any symptom of COVID, they should not be coming to work. And that's really tricky right now because everything except sneezing is a symptom of COVID. So it's really tricky to manage this, but the reality is if you risk it and get it wrong, you could have lots of people getting sick and business continuity issues and that loss of reputation, and it's just not worth it. So if you're not familiar with CDC requirements for screening and timelines for quarantines and processes for returning people to work, you're going to want to do some of that reading. Like I said, the plans that Virginia has put together will spell this out, but you do need to be familiar with that because it is now a standard with which we have to comply. So the standard also requires us to conduct a hazard assessment. These resources are available through the Department of Labor and Industry website. I'll provide that link for you. The assessment is going to determine your risk level. And as I said, each job task or category has to be assessed individually. So it could be at an individual employee level based on the job tasks that people are doing. And this helps establish the need for the administrative and engineering controls that you as an employer are responsible for. And those are really fancy words in the safety world. And administrative control is training. And engineering control is when you physically change the environment to make sure something can't happen. So those are just fancy safety words for different things we do to ensure safety in our workforces. So as I mentioned, the standard has the requirement for physical and social distancing. I know we've all been hearing about this for a long time, but we need to make sure that we have the ability to distance because that affects your hazard level. We are required to provide announcements, signage, and visual cues for physical distancing. So we have to announce to our team members the requirements, we have to have signage up, and we have to have visual cues. So this is the dots that people put on the floor that say, stand here, please wait here. But keep in mind, physical and social distancing applies to your break room, your back room, and your office as well. So I've talked with some retailers that are in our franchise family, and they did a really great job doing all of this and applying it to their sales floor. But then when people were in the back room, they didn't enforce physical distancing. They allowed people to take masks off. They ended up with an outbreak because they didn't think standards applied everywhere. So keep in mind when you're talking about physical distancing, this is break rooms, this is offices, it's back rooms. So if you have, like we do, we have a tiny little section in our back room that is our break room. We've had to limit that to one person at a time. Some businesses I know have just closed their break rooms because they didn't want to have to manage who was in and out, but keep in mind it does apply. You can decrease worksite density if that's possible. And you need to have controlled access or closed spaces where physical distancing is not possible. And then for common areas, we do have requirements for signage. We have to list the occupancy of the space with physical distancing or whatever Virginia standard is at the time. And we all kind of know they put different standards in place where they said you could have 50% of your occupancy, or you could have, at one point it was 10 people, whatever the current requirement is, we need to have that posted on our doors. We need to let people know that they have to practice physical distancing. We need to provide hand washing, and if you don't have available sinks, then hand sanitizer for your common areas. And we have cleaning and disinfecting requirements of shared surfaces. So when you think of shared surfaces, it's anything that more than one person touches. So in a retail environment, that's pretty much everything, everything that we have. This would include time clocks. This would include cash registers. So keep in mind, this applies to any shared surface. In terms of cleaning, we are expected to clean and disinfect all high, that should say touch areas, not tough areas, sorry about that. And we have to clean at least once each shift. If you have multiple shifts, you would be cleaning at the beginning of each shift. If you don't, you have a requirement to clean at least once every 12 hours. And you have to clean using EPA approved cleaners for handling COVID-19. They're list in disinfectants under the EPA. You can use this link to find out what they are. When Virginia issued its emergency standard, they required that we use strictly what's on this list. The permanent standard allows us to use equivalents. Because if you remember, there was a time in COVID, we were all fighting to get approved cleaners because everybody was trying to get them at the same time. They are allowing equivalents, and you can get that information on the website. So if you're in the very high and high categories, you have to have a written disease preparedness and response plan. You also have to have a written plan if you have are in the medium category with 11 or more employees. There is a template of this on the website, but please keep in mind, these templates are not things you can just download and say, we have the plan. You really honestly have to go page by page and customize them for your business. But the nice thing is Virginia does provide a template that you can work with, but just be aware, if you just download that plan, don't do anything to it, and VOSH walks in and you say, here's my plan, it's not going to count as a plan. You do have to customize it. You also have to designate a person that is responsible for implementing the plan. And as I said, there is a guidance document on the webpage, so you don't have to create this from scratch. And here is the list of resources for you. So I've made a copy of the presentation available to Retail Alliance so that you can get these as hyperlinks. The first one is an informational webinar that Department of Labor and Industry did. A lot of the information I've covered here was also covered in that webinar. They go into a bit more detail about some items. All of the available documents for employers are on the Department of Labor website, so I've provided that link as well. The third link, the reporting link, and I'm not yelling on the last two, but it was something about these hyperlinks. When they came in all caps, all of my text after them were on all caps. So nothing special about the last three. I just couldn't change my text, but that's the reporting link. Now, VOSH does offer consultation. So you could say to yourself, this is overwhelming. I don't know where I'm supposed to start. You can contact VOSH and they will come in free of charge and help you complete this for your business. The caution that I will give you on that is once an inspector is in your workplace, they can inspect not just for COVID-related items, but all related safety items under the sun. Now, if you receive citations from those inspections, there's no penalty or fine, but you are required to fix them, and usually very quickly. It's usually 2 weeks. To fix those citations. So if you want to do a consultation, that might be the right thing for your business, but just be aware you could end up with a very, 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 very long list of everything under the sun that you've got to clean up as part of that consultation. You do also have the ability to email questions directly to the Department of Labor and Industry about anything in the standard, and that last link is the email address if you want to contact them directly. So that's a high-level summary of the standard. The important deadline, as I said, is March 26th. This applies to all of us. So all of us need to make sure we are engaging with these resources and we have a plan in place. As I said, your plan will depend on your risk level. And hopefully this has been helpful in terms of high-level introductory information, and you can get much more detailed information in the resources that I've provided. So with that, are there any questions?
Are there none? You can unmute yourself if you need to ask a question. Wait a minute, Laura, you're You're muted.
Oh, sorry about that. I said either I explained it really well or I put everyone to sleep. I don't know which one it is.
No, I think it was very good.
It's high level. Like I said, it's a quick deadline though. So if you were not familiar with this, and I have to say Retail Alliance did, and I cannot remember, I think it was through the COVID briefings, made this information available the end of last year. So right when the standard was coming about, and that's how I found out about the webinar that I've provided for you. And that's what we use to kick this off in our business.
Yeah.
The last thing that I'll mention, I'm not a safety expert. I'm not an OSHA 1030, any of those things, but I've been working with safety for about 20 years. So if you have any questions, I'm happy to take a first stab at them. I may not be able to answer it. If I can't, I'll let you know. But like I said, if you just want to know what's a sample exposure plan, what's your return to work screening, how are you doing contact tracing, I'm happy to answer those questions. One thing I will mention just on the HR side, I mentioned protected medical information. Make sure you are aware as an employer that medical information should not be in personnel files. Medical information should be specifically in a medical file that is separate from employees' personnel files. That's law. So make sure you are complying with that as well. And I know it's easy as an employer, you open that folder, you throw in the doctor's note, you throw in they're cleared to return to work, you throw in the positive test, but that really needs to be in a separate medical folder that is not part of the personnel file. One thing I just thought about that I mentioned that I did not provide information on is anti-discrimination training. And you may be thinking, what's that all about? It's twofold. So there has been a rise in hate crimes against Asian Americans because of the early attribution of this virus to China. So there's a piece of this where you still have your general duty to provide a workplace that is free of harassment and discrimination, but you also have to be careful as an employer that there is no discrimination against associates who become sick with the disease. And this is very real because as soon as someone has COVID, your team's going to find out, not because you told them, but because it's a small retail setting. And then it's going to turn into, I don't want to work with that person because they had COVID, or I'm not comfortable working with them now that they're back because they were sick. You just can't have that. We have to follow the science. We have to make our decisions based on information. And if someone has completed their quarantine period and they've been cleared to return to work, we have to let them return to work, and we cannot allow associates to discriminate against them for having had the virus.
Lori, someone chatted in, what is the training deadline again? And someone put March 26th.
March 26th.
That's for training too. And that thing about discrimination, my daughter had it in November, and people are still discriminating against her and don't want her children to play with their children.
Yes.
It's been almost 4 months now.
Yeah. And so some of the key timelines, and again, you can get this from the CDC website. They have a lot of resources for employers. The reality is you can return to work faster if you test positive for COVID than if you are exposed to COVID. So I want to talk about two things separately. One is testing positive. The current timeline from the CDC is a minimum of 10 days, and associates can return to work if they have been fever-free for a minimum of 24 hours without fever-reducing medication, and there has been an improvement in all other symptoms, and they've been out a minimum of 10 days. So if you actually test positive for COVID and those three things apply, no fever within 24 hours, without fever reducing medication, improvement in symptoms, minimum of 10 days, you can come back to work. If you have a confirmed exposure to COVID, it is 14 days. And it really doesn't matter if you test negative 12 times. Now, some states, and I think Virginia at one point was allowing a return to work with double negative tests. So I would need to brush up to see where Virginia is on that now, but it's still a minimum of 10 days. But typically with exposure, it's a 14-day quarantine. But let's talk about what counts as exposure. Exposure is I was within 6 feet for 15 cumulative minutes with someone who has tested positive for COVID. That is defined as a confirmed exposure. But what ends up happening is this. I don't know if I can come to work because my boyfriend's sister tested positive for COVID and he saw her on Tuesday. So you do have to manage a lot of these questions in the business. Unless the employee that contacts you was within 6 feet for 15 or more minutes over a 24-hour period, they do not have an exposure to COVID. So in that situation, my boyfriend's sister tested positive and he was around her and I was around him. Unless he tests positive, she doesn't have a confirmed exposure. So if you get questions like that and people say, can I come to work? Typically in those instances, if there isn't a confirmed exposure, it is okay for them to come to work, but I would just ask them to self-monitor and make sure, like everyone else, if they end up with any symptom of COVID, that they quarantine.
Hey, Lori, it's Woody. How are you doing?
Hey, I'm good. How are you?
I'm good. Hey, do you put it in the handbook, the employee handbook, or separate?
I would keep it separate, only because your handbook could outlive this and these standards could change next month. That's the reality with this. It is changing so fast. Virginia has said that if businesses want to comply with CDC standards, they can, but just know the CDC is changing their standards with the science as well. So I would have a separate kind of VOSH program that includes your prevention and minimization plans, your requirements for self-monitoring, your operational changes based on social distancing and the new cleaning, all of that good stuff. Because your employees are going to need to sign off that you've done all of these things. You're going to have a record that you've done the training, that they were given copies of the plans, that they know what to do. So I'd keep it outside of your handbook. I would just make it separate at this point.
And it's any employer that has over 11, you say?
Well, if you're in the medium risk category with 11 or more associates, then you have to have a written plan on file. Again, the magic thing is 6 feet. If you can keep your workers 6 feet apart, you can be in that low risk category. So like I said, for a lot of us in retail, it depends on the size of your office or your store. The medium category, I would say, is the trickiest one because it isn't low, but it isn't high or very high. So if you go onto the website and pull those resources and you say, okay, I'm medium, it's going to spell out for you everything that you need to do.
Okay. Thank you. It was good seeing you. Looking good.
I didn't realize, when I saw the last name, I didn't realize that was you. I said it was Woody, and I was like, I know you.
Anybody have anything else? Nothing? Well, this has been recorded and it will, I'm not sure, I know it'll probably be on our website somewhere. But Lori, we thank you so much as usual. This is a wonderful presentation, something that we all use as business owners. We want to get it right.
Well, thank you.
A lot of them are still getting it wrong. That's
right. That's right. Well, and the main thing is you have to know about this stuff. And that's why I'm thankful for Retail Alliance, because without Retail Alliance, I don't know, we asked Department of Labor of Industry, how do you communicate this stuff? And they said, well, we put it on our website, but I don't know any employer that has a routine checklist item to say, go to the DOLI and see what's new on their website. So really, I'm thankful for Retail Alliance inviting, well, first of all, making the resources available to me first, and then inviting me to share this, because this is now gone from an emergency standard to a permanent standard, and it is a requirement for everyone.
Right, right. And we thank you. And of course, as always, the links will go out to everybody along with your information. Really appreciate it. So thank you. And I got several, I don't know where my chat room went, but it went somewhere. But there were there it is. Thank you so much. Very helpful and informative. And let's see, I don't know where they all went. Thank you, Lori. Very informative. It was great. Thank you for sharing. Excellent information. So everyone's very appreciative of this. Very,
well,
very
good luck and be healthy and be safe.
Okay. Thank you so much, Lori.
Thanks, everyone.
Thanks, everyone.
Bye-bye.
Thank you. Bye all. Thanks.
Bye-bye.
Bye.